I'm Kara, and I created a company called Teal Health, and I'm gonna let you in on our big ambition. You ready? All right, scooch closer. Seriously, closer. You're gonna wanna hear this. This is good. There we go. Yeah, scoot. Edge of your seats. This is edge of your seats, not moving. Scooch, scooch. Okay. We're gonna eliminate cervical cancer in the US. And we're gonna do it through screening. Because almost 4,000 women a year in the US die of cervical cancer. That number could and should be zero, because cervical cancer is entirely preventable through screening, catching the disease at its precancerous state. However, close to 1 in 3 women are currently behind on their screening. Why? The dreaded scooch. Screening in the US today, what we often refer to as the pap smear, requires a woman to go into the doctor's office and scooch, scooch, scooch her way to the edge of a table where a doctor collects a sample using a speculum and a stirrup. For those in the audience nodding, cringing, groaning, you know. The rest of you, just trust us, it's not great. So, it's just not easy in general to get a screening. It's hard to find a doctor's appointment. It's hard to find time in your day, whether that's for work, childcare, transportation. And as I mentioned, no one really looks forward to the visit. We also have an increasing shortage of physicians in the US and rising healthcare costs. This problem is only going to get worse. There's only one way to solve this problem, and it's by taking the cervical cancer screening out of the office and into the home by making it comfortable and convenient for women to stay screened. So that's what we did. Nice, it gets better. We really did it. We created the first FDA-authorized at-home cervical cancer screening, the Teal Wand. Thanks. Take a clap again. But when we set out to reimagine this whole experience, it wasn't just enough to focus on the collection. Yes, we needed an adequate sample, but what was really important is understanding how a woman felt. Was she confident in her ability to do this? Did she trust Teal with her health care? And so for over 5 years, we designed, we researched, we listened, we iterated. We took insight from many more than thousands of women across the country to design what it was that she wanted. So what did she want? She wanted a screening that was comfortable. She wanted to be welcomed into it, to know that she had everything she needed to feel confident that she could do it. She wanted her results to be accurate. She wanted to get them quickly, delivered on her mobile phone in a way that she understood. And if she had a positive result, be connected with a clinician that was empathetic, trauma-informed, and could explain what her results meant and her required next steps. While there are so many things I am proud of our clinical trial, there are 2 that stand out the most to me. 1, a woman's confidence. In our nationwide clinical trial, we showed that the self-collection with the Teal Wand had the exact same accuracy as a doctor-collected sample. A woman can take the exact same test that's used in the doctor's office confidently from home. And second, her experience. 94% of women prefer Teal to the standard of care. This is the healthcare that she wants. So we just got through the FDA, and we're sprinting as fast as we can to get this in the hands of women. We plan to be nationwide by January, just in time for Cervical Cancer Awareness Month. So I know I've been poking a lot of fun at the standard of care, and as we know, cancer is no laughing matter. So when I said earlier that we're going to eliminate cervical cancer in the US, I didn't mean the royal we. I meant the we in this room, right? Because today we learned the importance of screening. We learned the options that women have to be screened. So get yourself screened, tell the women in your lives to be screened, and together we can eliminate cervical cancer. Thank you.